Based on the official statement released by the NHS on the 9th of April 2025, it categorically states that the entry-level Band 3 roles that do not receive the high-cost area supplement will no longer be able to meet the salary threshold at the time of application. Now, what this means basically is if you're getting a job as an healthcare assistant within the NHS, at the point of application, you will be able to meet the new salary threshold requirement stated by the Home Office, which is expected to go, get into law or, implemented from the 9th of April 2025. Hey guys, welcome back to the channel. Now, on this video, I'm going to share with you the 3 major changes made by the UK immigration system that affect those who are looking at getting visa sponsorship within the healthcare space. So if you know someone who is currently a Band 3 within the NHS, or someone who is planning to get a job as an healthcare assistant within the NHS and hoping to get sponsorship, while working with the NHS, then you sure do want to stick to this video so as you get more information about some of these changes that has impacted those who are currently working as healthcare assistant or the Band 3 to getting visa sponsorship within the trust they work in, basically. So if you think you want to know more about this, don't go anywhere, keep watching till the end. And if you're coming across my channel for the first time, do want to hit on the subscribe button to join the amazing growing family. And my returning subscribers, thank you guys for being here. I really do appreciate you guys. So without further ado, let's get right into the video. A few weeks ago, the UK government made certain changes on immigration system that affect a couple of individuals on different visa categories, and some of these changes affect not just those who are currently on a visa, even those who are looking at getting their naturalization done are also being affected by some of these changes. Now, however, the focus of this video is to kind of provide a guidance update following immigration policy changes, and this is an official released by the NHS just to kind of share the impact of some of these changes on the healthcare sector. Now, you can see this particular publication was published on the 9th of April 2023, and the NHS have decided to update their guidance on how immigration policies changes will impact NHS staff. So if you're an immigrant living and working within the UK and you're working especially within the healthcare sector, you should want to watch this video to the end. Now, as stated on the NHS website, you can see stricter immigration rules for carers and increased salary threshold come into effect and will impact recruitment of overseas health and care staff. So this, from the 9th of April, the changes that were introduced by the government have been implemented. That's taken effect, and this is definitely going to affect those who are looking at getting health and care job from the overseas within NHS and hoping to get visa sponsorship. Now, as seen here, it says from today, that's 9th of April 2025, employers will need to be aware of the following changes. And the first thing is care providers in England seeking to recruit new healthcare workers with occupation code 6135 or senior workers 6136 from overseas, or those switching visa or from another visa route, need to first provide proof that they have attempted to recruit a worker resident in England. So this is not just for overseas workers. So even those who are currently in the UK, probably on a student visa or on a post-study work visa, before an employer can give you a job, they'll need to prove to the Home Office that they've tried to recruit someone who doesn't need a visa in the UK. And if they're able to prove that they couldn't get someone else, then you as an immigrant who currently have a current visa trying to switch to the health care visa would then be able to get a job. So it makes it more challenging for those who are even already residents and the overseas applicants to get health and care job, because if there's another applicant that is resident in the UK, doesn't necessarily need a visa, the person will probably have more leverage over someone who is trying to get a new visa to switch to or relocate into the UK with. Now, the second thing is that the minimum salary threshold requirement for skilled worker, including those in the health and care visa, is now £12.82 per hour or 25,000 per year, and this is an increase from the previous 23,200. And this is a major concern, especially for those who are currently working within the NHS as healthcare workers. For a Band 3 role, you're not paid up to 25,000. So what that means basically is that the salary you're earning is not enough to meet the salary threshold requirement, which is one of the major box that need to be ticked before you are granted the health and care visa. So this is a major challenge, and we're going to hear what the NHS has to say about this in the next few seconds. Now, also, health and education occupation, including doctors, nurses, allied health professionals, and teachers, also have their minimum rates increased to reflect the latest national scale, meaning that the entry band 3 role did not, that do not receive a high cost area supplement will no longer meet the salary threshold requirements at the time of application. Now, the high cost area supplement here is basically healthcare related roles within location around London. So they have like an additional, salary being added, additional bonus being added to their salary, which make it possible for band 3 salaries within London area to meet the salary threshold requirements. So if you're looking at getting a band 3 role and you want to get sponsorship at the point of you getting the job, you probably want to start focusing your application towards organizations within the the London area, and those who have access to the high cost area supplement. That's the only way for a fresh band 3 to actually get visa sponsorship within the NHS. And the other way around this basically is you probably want to work within your trust as a band 3 for more than 2 years for you to become eligible to apply, because after 2 years your salary scale is going to move up within the same band, and with the increase in salary after 2 years, you definitely will be able to meet up with the salary threshold requirements. Now, let's read a little bit more about the salary threshold requirement changes. Now, due to the salary threshold increase, a certificate of sponsorship issued after today, which is 9th of April 2025, for entry-level band 3 that do not receive a high-cost area supplement will no longer be eligible for international sponsorship. Now, employers will need to wait until the agenda of change 2025-2026 pay award is announced to determine if it will bill above 5,000 salary threshold requirements. And this is the part where people are actually talking a lot about that. Oh, but there's a plan to increase the the agenda for change in 2025-2026, but as of today, this has not, there's no decision made on that yet. There's no increase, specified yet, and it hasn't been implemented. So you can actually make a decision yet on that until the agenda for change has been announced. Now, those band 3 roles that require renewal on the top step of 25,000 will meet the required skills and salary threshold and can continue to be sponsored. So if you've worked for 2 years and you've moved up your salary scale within that same band, you definitely become eligible. Now, all staff that apply for new visa or renewal or extension will need to meet the new salary threshold requirements at the point of application. They will not lose their status if they fall short of the salary threshold increase while holding a valid right to work. So if you're currently on a sponsorship as a band 3 NHS worker and you still earn the 23,000 pounds, your right to work will not be taken off even though you're below the new salary threshold requirements. However, by the time you renew your visa, which most people get 3 years visa, so it means that they would have crossed the 2 years mark, and the salary would have increased before the point of renewal, then you'll be able to apply for renewing your current visa. Now, the salary threshold increase will apply to those who are applying for skilled worker visa, including the health and care visa. So this is one of the major fear among people who are looking at switching to the NHS and hoping to get sponsored. And this is something, especially for those who are currently working within care homes and not within the NHS, it might not be a good idea now to switch visa or try to move from working within the care home to moving to the NHS, because if you move to the NHS, you're definitely going to start from the lower part of that visa of that band, and you wouldn't be able to get sponsorship. So if you work within the within care home for like 2 years and you're looking at moving to the NHS, you will need to start from the lower salary scale within that band. So you definitely will not be able to get sponsorship that way. So what I'll probably recommend is stick with your current role within your care home, and when the new agenda for change for 2025-2026 has been announced, then you can then think of moving to the NHS if the new salary threshold for band 3 meets the 25,000 threshold being announced by the UK government. I hope you find this video is also, if you do, click on the like button. If you have any questions, state those questions in the comment section. And if you're coming across my channel for the first time, do well to hit on the subscribe button to join the amazing growing family. And my returning subscribers, thank you guys for being here. I really do appreciate you guys. So this will be the end of this video, and I'll see you guys in my next video. Thank you.